But once they meet the doctor, then they realize that they come to the right place. Earlier, the mother-in-laws will not allow, oh, no, 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 this is unnatural. Your doctor may put somebody else's sperm or somebody else's egg. And she thought that, and she didn't become pregnant in the 6 months. So she thought it is better to die in the lap of the husband, rather to be, insulted life in the village. See, once you're a doctor, you lose your gender basically, because neither you are a male nor you are a female. Nor you are a Hindu nor you are a Muslim. Because I always tell the uterus is not a empty bag. It is a very intelligent organ.
Namaste, my name is Kavita. As a mother of 2 young kids, I know the emotions behind holding them in my arms for the first time. For many women out there, this incredible journey starts with science, hope, and a doctor who not only is very good in science but also supports the emotion behind it. Today, we are in conversation with Dr. Brigadier R.K. Sharma, one of India's IVF pioneers, a decorated army officer awarded with Vishisht Seva Medal, a mentor, a teacher. Not just that, he's also someone who has given a joy of parenthood to over 30,000 families. Let's hear it from him. How are you?
Fine, thank you. How are you?
I'm good, sir. So my first question is my personal favorite.
Yeah.
Dr. B, Brigadier B, what a powerful combination. How did this start? I want to know the history behind it.
Yeah. See, I joined Armed Forces Medical College way back in 1976. And over there, they don't only make doctors, they make gentlemen. And I got commissioned in Armed Forces as a captain in 1981 and served there for almost 31 years and slowly rose the rank up to the rank of brigadier. And then I took voluntary retirement because I wanted to continue with my passion, that is IVF ET treatments. We are, I would say, lucky enough so that the president gives us a person may retire, the rank doesn't retire. It lives you for a life.
It lives with you. When did you start this journey of being a doctor? In which year?
I was joined MBBS in 1976.
And this IVF one?
IVF one, yeah. I think this is a long journey.
It is.
Because it didn't happen in one day. Now when I look back in my life, I'm the 6th child in my family. Earlier, they used to have a big family. Yeah.
True.
So we were 7 brothers sisters and I was the second last. My mother, wherever she would go, I will cling along with her. And she was very spiritual and a religious lady. I think I must have been 3 years old when she went to one Babaji who used to stay in the village complex. So the Babaji suddenly came out and he had a very, powerful voice. He says, "Why you have come?" So my mother politely said, "Babaji, we have come to give the..." Then he just, I must have been 3-year-old that time. He just looked at me, "Ja, maa ki seva kar." I didn't know understand that time which maa he is talking about. And subsequently, over the years, I grew up and then I once went to Katyani temple. And there that Babaji was also there. He's no more now in Chhatarpur. And that Babaji also had one meditation room underground, and he never used to come out. So just coincidence that he came out and everybody, being from a religious background, so I thought I also must touch the feet. When I saw him, I went near to him, I touched the feet. He just looked at me, "Ja, maa ki seva kar." I didn't understand, both the correlation, why everybody is saying that only. So this is the one part of the story. The second part of the story is that I was a newly commissioned officer and posted in a semi-field area in the Jammu sector. There, I was looking after more than 5,000 troops. I was the only doctor there. So one day I was informed that one lady has committed suicide and I have to write her death certificate. So I went to see the dead body where it is. I went to the house and I saw one charred body lying on the floor of a 25, 26-year-old girl. So she was obviously dead, you know. So I wrote her death certificate and cause of death, burning due to suicide. But after that, you know, I was just, that's a very impressionable age, you know, 24, and you're just out of the medical college. So you have big dreams, okay, how I'm going to serve the society, how I'm going to do that. So when I saw this dead body, we had seen dead bodies in the college anyway. But those dead bodies and this dead body was totally different, you know. So I could not sleep for 2 days, you know, thinking she must be a daughter of somebody. You know, when this dead body will go, how will they react? How the brothers would react? How the father, mother would react? So I tried to find out what is the reason behind the suicide. Then I came to know that actually she was a case of infertility, and the couple was allowed to keep the family only for 6 months over there. So she had to return back to the village. And she thought that, and she didn't become pregnant in the 6 months. So she thought it is better to die in the lap of the husband, rather to be, you know, having a insulted life in the village by the own relatives and the people. So once I came to know about this, then my mind kept on churning. I wanted to become basically a cardiac surgeon, because these were the two research by 1975, when it came, 78, that IVF baby and the heart transplant. But these were the cutting edge technologies that time.
Yes.
So I had made up my mind, I am going to become a surgeon and I will do the cardiac transplant surgery in army. But when I saw this, and I think I changed my direction. There was a call that I must do something for these women, because that I realized would impact not only patient, it impacts the whole family.
True, that is very true.
So then I chose subject of obstetrics and gynae, because IVF you can't do unless you're a gynecologist, against the wish of all the family members, because they'd bleed, because in northern India hardly any male would choose this subject that time.
जब मैंने कंसीव किया आज से 10 साल पहले, तो मेरी गायनेकोलॉजिस्ट फीमेल थे और देयर वर कपल ऑफ अदर वुमेन हु आल्सो कंसीव. तो आपस में एक कॉन्वर्सेशन होता था कि फीमेल गायनेकोलॉजिस्ट वुड बी थोड़ी प्रेफरेबल ना, बिकॉज दे अंडरस्टैंड द ह्यूमन इमोशंस, द वुमेन इमोशंस वेल. फिर जब मैंने आपके बारे में पढ़ा और मैंने आपके पेशेंट्स के बारे में सुना, they all have such positive information, such positive energy towards you. उसमें कुछ जेंडर का रोल मुझे समझ ही नहीं आया. It feels like a human touch is more required. So what do you think? How this gynecology?
See, once you're a doctor, you lose your gender basically.
Oh, wow, yes.
Because neither you are a male nor you are a female. Nor you are a Hindu, nor you are a Muslim, nor you are a Christian. So you are a doctor. So you have to treat the patient as it is. And the patients also, they're looking for a good doctor. They're not looking for a male doctor or a female doctor.
That's true.
So basically, it all boils down to the proficiency, professionalism, ethics, empathy, and hard work.
True. And also the relationship
Between the patient, yes. Because एक lady आती है, maybe from village background, उसके लिए जो है, or even from the cities also, may not be very easy for them. But once they meet the doctor, and then they realize that they come to the right place.
True.
फिर उसके बाद there is no going back. And then there are some other medical, ethics also, that as a male gynecologist, there has to be a female attendant all the time. So that has to be followed very, very strictly. And but I have, gone through situations where it was an emergency life and death situation. only the husband was available. So I had to keep husband as a witness and do the treatment for the lady. Because then if there is no lady available, you can't say I will not do anything unless a lady comes. Husband is there, so husband can stand there. So you treat the patient as a patient, not as a female or the. When I suddenly decided to become a gynecologist instead of a cardiac surgeon, one of my aunt who was a gynecologist of olden times, so she told in Thet Punjabi, "Teri mat mari hai, tere ko to koi janani nahi aani. What will you do in your life? Better take surgery only."
So as you said that you were taking like 200 patients at a time.
Yeah.
So back when you started and now, do you see a shift in the awareness and attitude of patients when they come and meet you?
See, actually, infertile patients haven't changed much.
They haven't.
Because that time also there was a desire to have a child at any expense. And today also the same desire is there, because there's a biological instinct which is there.
Are they more aware about it?
Yeah. Now they are more aware and they have more choices as well. Because there's so many centers now in the government setups also and the private setup also. Even in the tier 2, tier 3 cities, you find there are ART centers are there. So awareness has increased quite a bit. Yes, and the taboos, against the IVF. Earlier, the mother-in-laws will not allow. Oh no, this is unnatural. Your doctor may put somebody else's sperm or somebody else's egg. So we don't want this. Say, तो हमारे खानदान में होता नहीं, तुम मत करो. That was it. So that I think that pressure is not anymore there now. Even the village people also know that this is a science and there is no hanky-panky in this profession. Yeah.
I understand. अभी की तो नहीं बात है, बट जब मैं कंसीव कर रही थी उस समय एक फ्रेंड मेरी थी, वो भी IVF के इसी प्रोसीजर से जा रही थी, which is not easy to go through, to be honest, for a woman.
Yeah, it's not easy.
But other than the physical pain, उसके लिए मुश्किल था लोगों के myth को समझना. A lot of people had this weird notion कि ये जो IVF से बच्चे होते हैं ना, ये weak होते हैं या फिर they might have some kind of deformity because they're not aware about it. तो ऐसे कोई myth जो आपने सुने हो और ऐसे.
Yeah, it's not only one myth. There are so many myths are there. What you should eat, how much you should take rest, and which medicine to be taken. But even if the doctor has written, when the patients are waiting outside, they exchange notes among themselves.
Oh, really?
Oh yeah, I did like this, so I became pregnant. You also do like this only. So तुम भी ऐसे ही करो. So there are a lot of myths on that. My doctor has given me this medicine. Why he didn't give you this? But they don't realize that every patient would require separate, protocol, tailored protocol. So they, keep exchange. So there's a lot of myths running around about the food, about the medicines, and about the rest, and all those things. And the main, I think issue which remains in the mind, that whether the baby is going to be normal or not.
True.
Yeah. See, IVF per se does not increases the chances of abnormal baby by the process. But in case they have some genetic disorder running in the family, that may manifest. So nowadays there are techniques available, the technologies available where we can detect abnormalities early.
Beforehand, yeah.
And then we can terminate those pregnancies. Though it doesn't happen very frequently. Like I have seen, I've hardly must have seen about 20 odd cases in my whole career where the child was having abnormality. Because I always tell the uterus is not a empty bag.
True.
It is a very intelligent organ. See, it can differentiate whether it is a human embryo or an animal embryo.
True.
Otherwise, it would have been very easy that you make a human embryo and put into the pig uterus or the goat uterus and take out the baby and have a barbecue also.
Oh my God.
It would be so easy. So even the animal uterus also knows that this is a goat's egg or it is a mice egg or embryo. So similarly, so that is one aspect of the uterus. It can differentiate between the species. The second thing is that it can also detect whether there is any abnormal or abnormal. If there is a gross abnormality in the chromosomal anomaly, it will not allow it to implant itself. And even if it gets implanted, then it may get rejected, so they may have a spontaneous abortions. So the uterus is able to make out most of the time. That is why 100% result is not there.
Sure.
So because only 30% of the human embryos, whether in IVF or in the natural, this thing also are normal. 70% the human embryos are abnormal.
I did not know that.
Yeah, because human race is not as fertile or having high fecundity as like the lower animals. Like when the cow is in heat or the buffalo is heat, they are mated with the male only once and they become pregnant. While the human being has got a choice of doing as many times.
Sure.
But still, every woman doesn't become pregnant, in the first.
In the first one.
Yeah. So that is a difference because the human embryo possibly and factually also is more evolved because it has to, it is a different higher species.
True.
So the uterus is a very, very intelligent organ. I always tell my patients, it will reject. So don't have a myth that I am going to have a normal child. So most of the time the uterus will do our job. And even if that uterus misses, then we will detect it and then we can, get it aborted. Yeah.
So human body is intelligent enough to take things
I would
forward.
say body, I think uterus.
Uterus.
The human body is, because I think that credit goes to the uterus.
Okay,
Yeah,
I understand.
yeah.
So you have been through this journey for quite a long time.
Yeah.
Is there any specific case ऐसा कुछ था जो आप कुछ ऐसे cases होते हैं ना जो आपके साथ रह जाते हैं या आपको कुछ बदल सा देते हैं, कुछ ऐसा है जो आप शेयर करना चाहते हैं?
एक्चुअली क्या है कि आदमी लाइफ जो है ना, ये आपको कई रंग दिखाती है, ठीक है ना. I'll give you 2-3 examples.
Okay.
One serving officer, कर्नल साहब, उनका इकलौता बेटा था. NDA में पास हुआ, very happy, and he became a pilot, very happy. And first solo flight, उसका air crash हो गया, and the boy died.
Oh God.
Now imagine the plight of those, middle-aged couple now. So they came, and that lady used to carry that picture of the son always next to her. Doctor, please bring my son back. Please bring my son back. This is a picture. He comes in my dreams. मेरे सपनों में आता है. इसको वापस लेके आओ. I know आप ला सकते हैं. I know I cannot. But I cannot say he will not do anything for you also.
For you, for her, you were the hope.
Yeah, you as well. So, but she was already, 40 years plus, so perimenopausal woman. So we had to do the donor egg. I convinced them, okay, I can't do with your egg, but I can do with the donor egg.
Okay.
And the donor egg concept also जो है, I'll explain to you how it is different. So finally they had a child.
Okay.
And I'm so happy with that. Then there was a young couple. This boy in the field area, he walked into the mine, and that mine blasted, and the whole of his lower abdomen was, injured and all. Poor chap, and with the result, his genitalia was also affected. He could not bear a child, and it was a love marriage. So you can imagine how it is. So he came to me, the wife, in all tears. Okay, I said, don't worry, I'll do something. So I normally investigated the whole thing, and then I found out that he is making sperms. It's only the passage has got blocked. So उसका जो है, then we retrieved the sperms directly from the testes, and with his wife's egg, so she could become pregnant and have a child.
Wow.
And that came in the news that time, कि a soldier getting a new lease of life, has a new baby. So
I'm getting
that's
goosebumps
why.
listening to all the stories.
Yeah. Because in army you see so many of such situations. One day I was waiting, I was just closing my center, it was already 7 p.m. I had seen all my OPD patients, and normally I used to close the doors and then go inside, rest for 1 hour, and then do the ICSI, the putting the sperm directly into the egg with the help of needle. But that is a very, very delicate job. So by 7 o'clock evening, I used to be tired, so I used to have a break of 1 hour.
And then start.
So and then wake up again, and then after a cup of tea, I used to do that. So then I told my staff, okay, please lock the door and you all go, because staff also have to be sent, because that is my job, not is their job, that I should punish them also to remain awake with me.
How considerate.
So I used to send them. So he says, sir, एक जवान सुबह से बैठा हुआ है and he is not going. And he says कि जब सब जाएंगे तभी डॉक्टर को अकेले में मिलूंगा मैं. I said, fine, बुलाओ, क्या प्रॉब्लम है उसके. तो he came and he says, can I close the door? I said, हाँ, दरवाज़ा बंद करो. बैठ गया. कहते साहब, आप जो है ना मेरी वाइफ की ज़िंदगी बचा दो. मैं क्या, क्यों, क्या हो गया? तो उसने जो स्टोरी बताई है नटशेल, उसका जो है बाल विवाह हुआ था. He was a very small child, he told me, must be 10-11 years old, और माँ बाप ने ज़बरदस्ती उसको घोड़ी पे बैठा दिया. कहता मैं रो रहा, मेरे को नहीं बैठना घोड़ी पे, मैं नहीं, ज़बरदस्ती उन्होंने मेरी घोड़ी. कहता मैं रोता रोता ससुराल गया. ठीक है, वहाँ जाके मेरी शादी हो गई. मुझे नहीं मालूम. और उसके बाद जो है वो द गर्ल केम एंड हम लोग जो है दोनों गुल्ली डंडा खेलते थे, पतंग उड़ाते थे. मुझे नहीं मालूम था ये मेरी वाइफ है. दैट टाइम आई थॉट आई गॉट अ फ्रेंड. कहता मैं तो खेलता था. कहता अब जो है मेरा जो है बच्चा नहीं हो रहा, तो मेरे फादर कहते हैं कि यहाँ तो तू दूसरी शादी कर ले और यहाँ जो है इसको मरवा देंगे. ठीक है ना, फिर तो तेरे को दूसरी शादी करनी पड़ेगी. कहता आई कैन नॉट बियर दिस, बिकॉज शी इज़ नॉट माई वाइफ, शी इज़ माई फ्रेंड ऑल्सो, बिकॉज बचपन से हम दोनों इकट्ठे खेले हैं. तो कैसे, तो माई पेरेंट्स आर नॉट बेंट अपॉन गेटिंग मी सेकेंड मैरिज एंड divorces, or they will say if you don't divorce then we'll kill her,
Because of the kid, they
wanted a kid. So it was a difficult situation for the soldier, because he was so much in love, because not only as a wife, because वो बचपन से खेले इकट्ठे. So that boy was very interesting also. He used to tell me a lot of stories, mythological stories and all. And finally they were blessed with a child and with the IVF. So I said, now you stay together and don't send.
Now I understand all the patients that I have heard upstairs. ऊपर हम जब patients का interview ले रहे थे, why they say that you are not nothing less than a god for them.
No, I wouldn't say we may be playing God, but we are not gods.
That I understand.
It's all is the grace of God. You are chosen to do the job. It's His job only, because it's not in the human hands possible. If somebody takes the credit, oh, I have done it, I don't think. It is all designed by God, and the things happen by itself.
You are the messenger of it, at least. Somebody who
He has chosen. He has chosen. So that way, I can say that I am blessed. But otherwise, I can't take credit for it.
July 25th is IVF Day.
Yeah.
I want you to give a message to our parents who are holding on to hope.
Yeah.
Anything that you want to tell them?
I would say is that. Yeah. See, this is a very important day. When the first IVF baby was born in 1978. And to all the parents, those who are looking forward, because of this complexity of life, the wife also serving, the husband also working, so they don't have time for each other. So first thing I would say is please have time for each other.
So true.
And secondly, if you find any challenges there, then discuss with the doctor. And the person may find something. He may tell you some basic management. It may not be IVF all the patients. Every patient doesn't require IVF. Tell you frankly, maybe a small tips here and there, and small change in the lifestyle, some small medicines can make them parents. So they should not prolong their all the issues. So they should visit the doctor and tell all the things which they feel that is important. They should not hide anything. Like suppose somebody has got a tuberculosis in the childhood. Many times the ladies won't tell in front of the husband. So normally we try to have a counseling separately also. So the husband has got something to tell, he'll tell us, and then as a doctor we have to maintain the ethics of not opening the secrets of each other, and then it helps in the management. So they should tell everything what is their issues, and most of the time they require a basic treatment. It is only 10-20% of patients of infertility would require IVF. Most of them otherwise can conceive naturally also, if they come in right time. Nowadays what is happening, because of pollution, adulteration, stress, the ovarian reserve is reducing. The number of eggs is reducing. So you find that even young girls, they hardly have any eggs. And similarly, the male's semen sperm count is also decreasing. But since the males, they produce sperms in millions. So a few million less, doesn't make much difference. But woman forms one egg, every month. So the numbers are so less. So after pollution, adulteration, stress, the number decreases. It becomes visible much earlier that the new lifestyle is affecting the woman. It is affecting both, but it is more visible in the woman today.
True.
And so they need to, and the career women especially, now the practical problem which I see is the girls are very good, hardworking, and they are, well educated. They don't get the right type of partner.
Oh.
They keep on waiting to find the right type of partner. And with the result, the age affects their ovarian reserve. So if somebody is planning to marry late, or the marriage is not happening early, I think there's a social egg freezing is very, very important and need of the hour today in this lifestyle today.
This phenomenon is getting quite known of egg freezing.
Yeah.
If the women are more career centric.
Yeah. It is needed because otherwise, when they plan the baby, they don't have the eggs. Or they may have eggs which are likely to produce more abnormal babies, more chances of abortions that time. So in the young age only they should get the eggs frozen, so that they can pursue their career, or they find the right mate. Sometimes I find that I should make a matrimonial service also along with that, because nowadays, because there's such brilliant girls, but they don't get that type of partner. So I can't blame them for that.
Being a woman, I agree with you. All right. This is all the conversation we had. I think time when we believe that science and emotions are poles apart, Dr. Sharma's journey teaches us that no, it is a journey where both of these come together and make a couple happy. Thank you so much, Doctor. What a wonderful conversation we had.
Thank you very much. It was nice talking with you.
I'm pretty sure the conversation, the stories are going to stay with our hearts for a really long time, and for our viewers and listeners too. Thank you so much, sir.
Thank you.